You're listening to the Navigating Leadership Podcast, a podcast where you get to sit in on conversations I'm blessed to have with leaders from around the country and right here at home. I'm Dave Freund, and welcome. This week, my special guest is my son Jeremy of Crouse Hospital. Jeremy is helping set up the Crouse Leadership Institute. Let's jump into the conversation and learn more about this exciting project. So today my guest is Jeremy Freund. Those of you that are my listeners, you're going to recognize that last name. So Jeremy is my son. Jeremy, welcome.
Thank you for having me.
Our listeners don't know this, but I do. You are an RN with a master's. You were a bedside nurse that worked in an ICU for years.
Yep.
Although there was a time when you wanted to be a marine mechanic.
That is true.
Which you sort of do.
Yeah, a little bit, yeah.
Whenever I have an issue with an engine, you're always there for me. But you had a dream at one point of being a flight nurse.
That's correct.
You were a volunteer fireman. And so what are you doing now? And how did you go from keeping people alive to what you're doing now?
Yeah, the path is kind of odd, and it's one of these things that, doors open and you don't really know why you're doing something or, what the end goal will be. Doors just open along the path. So yeah, I started as a first a med-surg nurse. I worked 1.5 years in med-surg and then went to critical care. My ultimate goal, I wanted to be a flight nurse. So I went to critical care, adult ICU here at Crouse Hospital, spent several years there, had no intention really of leaving because after I'd been there for a few years, the whole flight nurse thing kind of went away and I loved it. It's one of the most fun jobs I've ever had. It sounds silly to say the sicker the patients, the more exciting it was to care for. Had no intention to end up in somewhere else, but the educator for the ICU walked around one day and she's like, Jeremy, I'm taking the manager role. I want you to apply for the educator role. And I turned her down. I said, no, I don't want to be an educator. I don't want to teach. I don't want to do that. And she said, okay. And she came back about 1 year later and said, Jeremy, I want you to take the educator job. And I turned her down again. And then at that point, we had our first son, and the hours and schedule were not something I really loved, being a father and a husband and having conversations with my wife. We decided, maybe this is a good opportunity. At that point, I didn't really want to teach. It wasn't something I had a dream of teaching. It just seemed like an interesting opportunity. I loved teaching on the unit, helping the newer nurses, but it wasn't something that I wanted to do in a classroom. But I thought, what, great opportunity, we'll give it a shot. And, fast forward 9 years, I taught critical care nursing and absolutely loved it. Being able to have the new nurses come in and walk through what that's going to be like for them and provide those skills and knowledge and things for them as they grew in their role was awesome. I loved every second of it. Had no idea I was actually going to change that job either. Our department, the education department here at Crouse Hospital, for a few years attempted to start some leadership development trainings. We had done them historically even before I got here. Several other educators had put together some programs. We worked on some things, and a lot of things, they got rolling, and then obviously COVID happened, and that stopped a lot of our leadership development trainings, and some educators left. And it was actually post-COVID when we could see in the institution that we really needed some type of leadership and professional development. There's a lot of leadership development companies and individuals in the community, but nothing really with a healthcare focus. And we had some conversations internally, and you and I had some conversations that really what would be great is to develop a leadership development program with a healthcare focus. So along with some other of my coworkers here, we did that. We put together a proposal and it got approved. So currently I'm the Leadership and Professional Development Coordinator for the Crouse Leadership Institute. So we do all different types of leadership development classes, professional development classes, leadership coaching with kind of a healthcare viewpoint, right? So when you can understand what it's like to be a nurse manager because you've been there, it's a little easier to help these individuals work through what they're doing. So I have transitioned out of the critical care educator role. We have a new educator that came in and she's doing amazing. And now my focus is leadership and professional development um, all the time. And it's super
Awesome.
fun. And it's one of these things you don't really know what's coming next either. So I never thought I'd be doing this,
Right.
but I'm enjoying it.
Right. So you talked about the fact that you loved being an educator in the ICU, um, but that you saw a need or a
Yeah.
need was discovered that there was a need for leadership development. What did that need look like? How did you know there was a need?
Well, a lot of it, and I've been at Crouse since 2010. Um, yeah, a little around 2010. And I've developed a lot of relationships here. And in my educator role, I spent a lot of time with managers, specifically nurse managers. And what I would hear from them is specifically during COVID and post COVID, right? The healthcare went through some really difficult times. Everybody did, obviously. We lost a bunch of staff. We have a lot of new staff. And what was clear and what was expressed from these managers is they were struggling. They didn't know really what to do, right? Healthcare had kind of functioned in a certain way for many, many years, right? You had very seasoned staff that was able to help mentor younger staff. We had very seasoned managers. And now all of a sudden we had a lot of new staff. We had a lot of turnover in our leadership, and we didn't have a lot of resources to provide them the skills, the training, and the resources to be effective in their roles. And we would just have conversations. And they would say, well, I don't know how to handle that situation. Or they would ask, they're like, what do you think would be a good way to handle this? And, just, I guess through osmosis, being your son, I heard a lot of the John Maxwell things over the years. And a lot of those principles I already knew from books that I had read. So we were able to start sharing things, and people were like, wow, we should do that here. Right? We should do some more of these trainings. And I think the big part is because I was part of it and already had these relationships, you could hear them say it and you could see it too.
Right.
You could see
Sure.
these leaders really struggling with, what the newest generation of nurses coming in, not knowing how to communicate with them.
Yeah.
Because it's completely different from the nurses they had worked with before. And it's not just nursing. Now we're doing, all the different disciplines here, but at the time it was primarily nursing. So a lot of it, having the conversations and just viewing it, the struggles that they were having.
Thanks for sharing that. I remember it last year's Live to Lead 2023. And my listeners know what Live to Lead is because my last podcast episode was just what is Live to Lead with some other Live to Lead hosts. Um, but I remember Marcus Buckingham saying that, the highest percentage of the profession with the highest percentage of people that dislike their jobs were nurses. And the sad part was, these are the people that went into it because they wanted to help people. They wanted to be with people. I remember once having a conversation with you and Tim, your younger brother, who's a PA, and I think you said something about, your role is that you care for the patient's well-being and their family.
Mhm.
And Tim is, I diagnose an illness with a doctor and we prescribe a treatment plan.
Right.
So imagine I'm thinking about these people that went into it because they want to help people, they want to care for people, they want to be there for people's families, but they're so unhappy with their job. How could they do that if they're unhappy with their job? And that's probably why you had such high turnover rates.
Absolutely. And, I just want to emphasize a lot of our training is not just for leadership here, right? I taught this week on Wednesday already. I was teaching the brand new NICU nurses that were coming in, right? So it's not just the leaders that are needing additional insight and resources. It's the whole staff, right? We're trying to, work with the newer staff too, so we can improve the teamwork and the communication. So we're all improving, not just
Right. Good. Yeah. So and I like how you talked about that. If I heard you correctly, so the new nurses coming in, you're teaching them communications, you're teaching them teamwork things,
correct.
skills as well.
Yeah, so the one of the trainings I did this week was we did a whole training on disc personality profiles, and then I do a whole generational navigating a multi-generational workforce. So every new nurse that comes in gets a disc training and a generational training. and another one of our educators does additional trainings, and they talk about empathy and teamwork and a few
Great.
other things. So specifically, the nurses are doing that, and in 2025, the goal is to open that up to a lot more of the staff.
Awesome. So you talked about generations in the workplace. What's what's the difference in the way a nurse that's my age approached their job and their life versus a new nurse?
Um, I think when they started, they all approached it the same way, right? So
Okay.
when you enter into a new career, they all approached it similarly. The difference is the time, right? So our new nurses coming in, I can speak specifically for nursing because I've been one for a long time. The technology has changed a lot of things. And yes, the view is the same when you start, but what they're using when they come in, the technology is changing things. Where we're seeing our struggles with the generational is we have senior nurses who's experienced a lot, they have a lot of wisdom, they have a lot of knowledge, and they're struggling to understand the youngest generation, the why they do certain things, right? Why they communicate a certain way, and vice versa. The youngest generation doesn't understand why the senior nurses communicate that way, right? Why they carry themselves that way. And it's a lot of, when we talk about in our training, it's how the generation was formed, right? What is it formed from? We use Dr. Elmore's book to do a lot of the
Yeah.
training for that. And really, it's a lack of understanding. And it was when I did the training this week, we talked about that. We went through. I said, you guys are sitting here arguing with each other. You have the same goal in mind. You've been, they've been where you are. It's just you don't really understand why they are the way they are. And once you can understand it, you can then communicate a little bit better with them and hopefully improve some of those relations, right? Because we're seeing quite a bit of it. We're seeing a lot of arguments and between two specific generations, and we're seeing staff leave because of it. They're like, you know what, I just don't want to deal with it anymore. When you really understand why they are the way they are, it helps to ease some of that.
Thank you. So it sounds to me like using Dr. Elmore's book as a base, which is helping understand the generations that these generations that typically don't communicate well, you're helping them understand where they're coming from and showing them that they really all have the same goal.
For sure. Yes.
They're just expressing it differently and experience different things to get there.
Yeah. We have when you look at specific generations like the baby boomers,
Yep.
right? We hear a lot from the baby boomers that they reached a point in their career where they shouldn't have to take the difficult assignments. They shouldn't have to work as crazy of a schedule every other weekend, every other holiday. It should be up to the younger nurses.
Right.
They've earned it. And the younger nurses go, and that's a lot of just because of the development of that generation, right? And then the
Yep.
younger nurses go, no, wait a second. If I have to do this, you should have to do it too. So we see a lot of that, not fighting, but resentment almost. And then,
Yep.
but when we can have the conversations of, why does the younger generation really prioritize flexibility and self-scheduling? Why? Because we gave them the ability to do that in their formidable college years, right? They did college online and flex paths and all of these kind of things, but then we bring them into an institution and say, no, you have to abide by this. When we understand why they are the way, okay, great, I understand it. How can we adjust so we can kind of appease and meet both sides?
Right. Very good. I like that. Um, how did you're in the leadership piece. You talked about the fact that maybe some osmosis, just Sunday evening dinner,
Yeah.
things started coming to you. What do you like about being in the leadership side that you didn't have on the bedside training?
I think one of the big things, I get to work with a lot more people, right? So I loved critical care. I loved, again, I mean, we would have people that if you know what an ICU does, people are dying, right? And you really
Right.
get to change people's lives. And I've really felt that I did a great job, and I loved that. Getting the ability to work with everybody in the institution and being able to add value and give people I would have never worked with before, right? I get to work with our environmental services team. I get to work with our dietary team. I get to work with our addiction treatment team that's in a whole nother facility. And I get to help them reach their goals and help provide resources and tools so they can improve.
Yeah.
That wasn't something I had the ability to do before, right? So it gives me, Crouse Health, it's a fairly large institution, and the ability to have a larger impact is I didn't realize it at first, but it's one of the fun parts about my job. I get phone calls all day long from people I never would have talked to before when I
That's
was in
great.
my small role in the
That's great.
ICU.
Um, and anybody that's been on a podcast with me, well, especially Marissa, she knows I always ask questions that she never knew I was going to ask. And I gave you a few questions that I was going to ask, but none of the ones I've asked so far were you prepared to answer. But you've done a great job. You used to love the adrenaline rush of a code that was called or a fire alarm that went out.
Yeah.
Is that need for that adrenaline rush gone, or is it just different?
No, it's different. So I thrive on adrenaline, right? I mean, that's why I went into the fire department. That's why I wanted to be a flight nurse. Um, I'm getting older, right? I'm not old, but I'm getting older. Um, and it's kind of changed. And where I get my adrenaline rush is teaching.
Okay.
I love to teach. And, there's different parts of my job, and I think that's with every role, right? There's different parts of my job that I love. There's different parts of my job that I tolerate, right? And there's other parts I don't like. But
Sure.
the one I love is getting in front of people. And a lot of my coworkers, they might not even, they sometimes don't understand. Like it brings a smile to my face, and I get all amped up, and I get really loud. As everyone knows me, I talk really loud and I talk really fast. But that adrenaline comes from in being in front of people and interacting with a class, um, and really, that's the big teaching for 8 hours straight. It's exhausting, but that's kind of where that adrenaline has
Right.
changed to, is really just being in the classroom. I love that.
Okay. Great. Thank you. So what's one of the greatest lessons you ever learned and who did you learn it from?
Um, you sent me this question and I spent some time thinking about it, and I don't know if I can identify one greatest lesson. I've had a lot of great lessons in my life. The one that's affecting me most recently, that I've really spent a lot of time contemplating, and it's embarrassing to say because this is not new. Uh, Personal growth just doesn't just happen.
Mm.
I I got the dream. I got the dream job, right? I get to teach leadership and professional development. Dr. Cronenberg, we gave me permission to create this institute and to do leadership and professional development. There was actually a point a few weeks ago, month ago or two, had a conversation with my wife, and I was kind of in a slump. And she's like, "What's wrong with you?" And I said, "I don't know. I got a great job. I'm teaching. I love that, but I wasn't super passionate at the moment." And that I was actually rereading uh, the 15 Invaluable Laws of Growth. And
Yep.
I reread the 21 Irrefutable Laws of Leadership. And there's two laws in there's one law in each one of those that jumped out to me. It said, if I'm not actively working towards personal growth and development, I'm going to end up in this funk, right? Or not, I don't even know if funk's the right word, but if I'm not growing, I'm going backwards. And I had reached a point in my career where I had this dream job, but I had kind of reached a kind of lull because I wasn't putting the intentionality in my own personal growth, right? I would go, to the John Maxwell conference, and you get re-energized and you teach off some of those things for a little
Right.
while. But until I got back into the day to day being intentional with my own personal growth,
Yep.
I had reached a flat point, and that's shifted in a lot of the teaching that we're doing for 2025 is back into that personal growth piece.
Awesome.
If you're not driving yourself forward, how could I go teach other people to do that if I'm not doing it?
Right. Yeah. John Maxwell would say you can't give what you don't have.
Right. Yeah. And it really hit a point. It was all aspects of my life. It wasn't just my job here, right? It was being a husband, being a father, all those things. I had kind of just been, ugh. And it wasn't until something I'd read numerous times already, it just hit me a little bit different. And I had to be much more intentional with that personal growth. And I've seen the effects of it over the last 2 months, which is exciting.
Great. Awesome. So you kind of get launched into my second question. So what are you learning right now?
Well, personal growth, right? So the we're going to be announcing here a few trainings for 2025, really with the focus of personal growth. Because what I've noticed, and I'll get into what I learned, but what I've noticed when I've talked with new leaders, one of the first things I ask them, not even new leaders, just leaders that are asking for some coaching, I ask, what do you want? What's your goal? And then what are you doing to get there? And what I'm getting from a lot of people is they don't really have a goal
Yeah.
and they're not really doing anything for personal growth. And what conversations with the leadership teams here has come around saying, before we can get into helping them with communication and motivation and delegation and all of these leadership skills, we need to help them with their own personal growth, right?
Oh,
We
that's
talk about the
great.
law of the lid and things like
Yes.
that. So that's really where our trainings have focused. And the one book I'm actually starting, it's on my list to start probably this weekend reading, is the 7 Habits of Highly Effective People, Stephen
Ah,
Covey's book.
Stephen Covey. Yes.
And we're gonna do some I've mentioned some of the things in this book and other trainings, but we're gonna actually pull out some and do some just direct trainings from this under the umbrella of personal growth for next year. So I'm excited about that. But I'm kind of in between books right now
Okay.
as we're preparing for the next few months here.
So since we're on the topic of books, so what have you read that you think others need to read and why?
I don't want to repeat myself, but I think there's really three. If I'm on my personal growth trend, which I am
Yep.
right now, I would start with the 15 invaluable laws of growth, right? We need to, it was very impactful for me to do kind of an evaluation of myself. What was I doing on a very personal level? Even if you're not in leadership, it gives you a good view of yourself just in life. And then the 21 irrefutable laws of leadership, right? If you're in that leadership role, really helping to identify where your shortcomings are and a process to improve those. And then
Yep.
one that I read and I want to reread again is Atomic Habits.
Yeah.
So if you're on that personal growth journey and you are intentional about it, you're going to have to develop certain habits. And that book does an exceptional job of assisting in that.
Is that James Clear's book?
Yeah, James Clear. Yeah.
Okay. Thank
I'm not one that is really good at sticking to things.
you. Uh-huh.
My ADD just has me all over the place. And that was very helpful to say, you know what? Do this because this will be your ultimate. If this is your goal, do these steps and you will achieve that.
Okay. Thank you.
So those would be the three I would start with. We can keep going of all the recommendations, but those were the three.
We'll have to have you back after you refocus on these three again.
Yeah.
So, I was listening to a podcast yesterday, and it was actually an interview, and I'm going to write about it for my next post. But there was an interview with a guy that was the founder of Waze,
Mhm.
the app that we all use
Yep.
to get around traffic jams. And he talked about, he said, life is really a journey through failure, but he meant it in a very positive way. So, how has failure shaped your life?
I mean, you don't like to say it, but failure, I think, has the greatest impact on your life, way more than your successes do.
Yeah.
And the only reason that, if I can say I'm successful at this point is because I failed at a lot of things. And probably one of the things that I did and failed that changed me the most. I don't like asking for help. I don't know if it's a personality trait. And that really got me into trouble in my critical care years. I just don't like asking for help. I don't know if it's a I think I can do it better but than everyone else. Um, but it got me to points where, when patients' lives are on the line, if I don't ask for help, something bad is going to happen. And what that taught me, it was a great lesson. And now I have an amazing team around me. And even though it doesn't come naturally for me to ask help, getting really close and failing a lot of times because I didn't ask for
Yep.
help has taught me, hey, before things get bad, make sure you ask for help. And I have an amazing team, and everything goes so much smoother. And a lot of people around me do a way better job on these things than
Sure.
I could ever do. I just have to ask.
Just let them.
Just let
Ask
them.
and let them. Yeah.
And they're incredibly talented. They're amazing at what they do, and they want to help, but I just get in my own way and say, no, I can do it. And I don't ask. And when I don't, oftentimes I fail. And sometimes it's pretty epic. And, I now am much more visible through
Yep.
the whole institution. So failures are noticed by
Right.
high people, and
Yep.
that's even more uncomfortable. So yeah, I think that, there's a lot of failures I have, but what I've learned the most from the biggest one is just you got to ask for help
Okay.
and let people help you.
Awesome. Now you know why I always ask for help when I have mechanical issues. So, what have you done that you would recommend other people do and why?
This is going to get right back to that my 2025 motto of personal growth. You have to stop. You have to take a moment and do some evaluation of really what do you want. It wasn't until I sat down and wrote down really what I wanted out of life,
Hmm.
out of my career, right? What were the things that I wanted to improve in, right? Did I want to become a better father? Do I want to become a better husband? And do I want to become a better, leadership and professional development coordinator? When I actually identified what those are, and then what were intentional about what steps I was going to take to get there.
Yep.
That doesn't mean that I've achieved that necessarily. It doesn't mean I'm actually going to hit every one of those steps. But if I didn't identify that ahead of time, you're
Sure.
never going to hit those steps. So that's not what I work with the leaders about. Okay, let's start. What do you want? And then what steps are we going to take to get there? You have to identify it first. You can't just let life happen because you're not going to achieve what you want if you just try to do that.
So, you talked about being in a funk. You talked about the fact that, what you've done, you want others to do and why it's, you got to have a plan. You got to know where you're going. That reflection piece,
Mhm.
reflection turns insight into experience. How has that changed your mindset? Are you out of the funk?
Yeah, so it's given me a strange optimistic view of a lot of things, right? So things I didn't think I could do, when I start to be intentional about taking steps to achieve them, they don't seem as daunting anymore.
Hmm.
Um, just happier too. I mean, one of the things is I wanted to get healthy again, right? I'm in my mid 30s. I wanted to get back in shape and, going to the gym and all of those kind of things. It, when you are, when you can see the steps of growth, you feel better, you have a more
Yeah.
positive outlook, and you start achieving things, and it builds that self-confidence inside you that, you know what, I can do this. Right? Instead of waiting for success to happen, you have the building blocks in there that you start to have this boost of confidence as you grow.
You create the success.
Absolutely.
Yeah. So my last question, what brings Jeremy joy?
I think the first thing is, I mean, and you know this, it's my family, right? So my wife, my amazing children, um, the ability to get to go to work so I can provide for them, right? It puts a smile on my face. And as an educator, again, the one of the things that still puts a smile on my face is teaching and getting that look from the people in the classroom. And only people that have taught know what I'm talking about. That look of, I get it. And I got that a lot in critical care, right? People that have gone through nursing school, they've gone through all of these different trainings, and they still don't fully understand something, whether it was the heart or the kidneys. And if I can take it and give it in a way to them that it helps them understand it, that look of, I got it.
Yeah.
And now in the leadership world, when individuals are struggling with something, and I can help in some way to add a little insight or to provide a resource, and they get that look of, I got it. It puts a smile on my face every day. I
Yeah.
don't think that's ever going to get old, because it's like, you know what? I can go home and be like, I was successful today, right? I was able to help add value to someone and make a difference in someone's life. And that's my goal.
That's awesome. It's when I started my Maxwell journey, Scott Fay, who was the vice president of the John Maxwell team and really the guy that with Paul Martinelli, convinced John Maxwell to take a risk at 64, 65 years old to start the team. Scott Fay said one time, I was at a small training that he was doing, and he said, once you've tasted significance, success will never do. And I think what you're talking about is that your joy comes in seeing the significance of what you're doing in people's lives. When a coaching client gets it, when somebody in a class gets it, and you realize you just in a small way help them enjoy life.
Absolutely.
And if they're for every manager that you're teaching, for every nurse that you're teaching, the nurse is going to take better care of the people, the patients. The manager is going to take better care of the nurses. That's one less nurse you now have to recruit.
Yeah.
And I think I'm super excited when you told me that Dr. Cronenberg wanted to start the Crouse Leadership Institute. I thought, wow, that is going to have dramatic financial impacts in a positive way on the hospital. It's going to reduce costs. And just at what it costs to recruit or sign on bonuses, you save a few nursing hires because you took somebody that had all that experience and now they're going to stay rather than go somewhere else. That's huge.
Yeah. And, when we talk with nurses, a lot of what we hear is, the number one issue that's facing healthcare right now is nursing shortages. It's,
Right.
And there's no magic pool to pull up, and not just nursing, all disciplines. There's no magic pool to pull hundreds of nurses into a healthcare.
Right.
So how do we fix this problem? We become more effective in our own roles, right? We communicate better. Our teamwork becomes better. And that's one of the goals of all of this. It's keep the people that are here.
Yep.
And help them be more effective in their roles. And so far we're seeing good results from it. So I'm super excited.
Awesome. Well, Jeremy, thank you for taking so much time out of your day to spend with our listeners of the Navigating Leadership podcast. Wish you the best, and I can't wait to hear how things roll out in 2025.
Thank you so much for having me.
What a great conversation with Jeremy. I love how Jeremy talked about the fact that recently he and his wife both noticed that he was in a bit of a funk. It was great that he realized, even though he had an amazing family and a job that he loved, something was missing. When he realized that what was missing was his personal growth, he took action, working on a growth plan, getting engaged again, and reading some of the books like the 15 Invaluable Laws of Growth that meant so much to him in the past. And now that he's on a growth path again, the funk's gone, the joy's back, and he's much more optimistic to tackling hard things. I thought that was awesome. Also, no surprise at all, the things that bring him joy, in addition to his beautiful family, is seeing breakthrough moments in his classes and with those that he has the privilege of coaching. Those were my takeaways from today's episode. What were yours? Until next time, I'm Dave Freund, and thanks for listening to the Navigating Leadership podcast.